Good evening. I'm Dr. Weiland, and tonight I want to talk about something that affects a huge number of people managing type 2 diabetes, especially those of us over 60, and that rarely gets explained clearly even after years of treatment. Why blood sugar so often rises overnight, even when nothing was eaten, nothing was done wrong, and a bedtime reading looked perfectly reasonable. Before anything else, an important note. Everything I'm about to explain is educational. It's meant to help you understand the physiology well enough to have a more informed conversation with your own doctor or endocrinologist. None of this is a substitute for personalized medical care, and nothing here should lead you to change, stop, start, or adjust any diabetes medication, especially insulin, on your own. Adjusting insulin without medical supervision can cause dangerously low blood sugar, and that's a genuine emergency. Please keep your healthcare provider in the loop on everything you learn here. Now, picture a fairly common scenario. Someone who's lived with type 2 diabetes for over a decade, who takes their medication exactly as prescribed, who eats a careful, modest dinner by early evening, checks their blood sugar at bedtime, and sees something reasonable, maybe around 140. They go to sleep having done everything right. And yet they wake up the next morning to find their blood sugar sitting at 180, sometimes higher, with no clear explanation. They haven't eaten. They haven't moved. They've simply been asleep for 8 hours. Where did that glucose come from? This is one of the most common and most misunderstood patterns in diabetes management, and it usually comes down to one of several distinct physiological processes, sometimes more than one happening at the same time. Understanding which one is at play matters enormously, because the right response to one can actually make a different one worse. The first and most common mechanism is called the dawn phenomenon. This is rooted in completely normal hormone rhythms that every human body experiences, diabetic or not. In the hours before you wake, typically between about 4 and 8 in the morning, your body begins preparing to start the day even while you're still asleep. Cortisol, your primary wake-up hormone, rises sharply during this window. Growth hormone, released earlier during deep sleep, continues exerting its effects into the morning. Your sympathetic nervous system becomes more active, releasing hormones like epinephrine. All of these are counter-regulatory hormones, meaning they work against insulin's effect. They signal the liver to release stored glucose and produce new glucose, essentially fueling you up for the day ahead. In someone without diabetes, the pancreas senses this glucose release and responds with a precisely matched burst of insulin, so blood sugar stays level even as the liver is actively working. But in someone with type 2 diabetes, where insulin resistance and reduced beta cell function are already part of the picture, that glucose released by the liver isn't met with an adequate insulin response. It accumulates in the bloodstream. The result is a blood sugar reading that climbs significantly between roughly 4 and 7 in the morning, even though nothing was eaten and the bedtime reading looked fine. This single hormonal surge can raise glucose anywhere from 20 to over 100 points, and it's entirely involuntary. It isn't a sign of doing anything wrong. The second mechanism is less common, but critically important to recognize, because mishandling it can be genuinely dangerous. It's known as the Samajai effect, sometimes called rebound hyperglycemia, and it works in essentially the opposite direction. Here, blood sugar drops too low overnight, often between midnight and 3 in the morning, sometimes into the 50s or even lower. Because most people are asleep when this happens, they never feel the warning signs, the shakiness, the sweating, the racing heart that would normally alert them while awake. Instead, their body silently recognizes the emergency and launches a powerful hormonal countermeasure. Adrenaline floods the system. The liver dumps stored glucose. Cortisol and glucagon join in. This response is designed to protect the brain, which depends almost entirely on a steady glucose supply. But in someone with diabetes, the response frequently overshoots. Blood sugar doesn't just return to normal. It rockets upward, sometimes well past 180 by the time morning arrives. The reason this distinction matters so much is that these two patterns look identical on the surface, an elevated morning reading, but they call for opposite responses. If a doctor sees consistently high morning numbers and assumes it's the dawn phenomenon, The natural response is often to increase evening medication or insulin. But if what's actually happening is the Samajai effect, increasing that medication will push nighttime blood sugar even lower, triggering an even bigger rebound, and morning numbers will paradoxically get worse, not better, while the person edges closer to a genuinely dangerous low overnight. This is exactly why identifying which pattern is occurring, rather than just reacting to the morning number, is so essential. There are a few other contributors worth understanding as well. One is simply the timing and composition of dinner. Complex meals, especially those eaten later in the evening, can continue releasing glucose into the bloodstream for 2 to 3 hours or more after eating. Someone might check their blood sugar at 10 at night, see a reasonable number, and assume they're set for the night, without realizing their glucose hasn't actually peaked yet and will continue climbing for another hour or two while they sleep. Medication timing is another factor. Some medications and insulin formulations have a duration of action that doesn't line up well with when the body needs the most support, particularly during that early morning hormonal surge. A dose that works well in the evening may have largely worn off by the time the dawn phenomenon kicks in. And then there's sleep itself, particularly obstructive sleep apnea, which is both common and frequently undiagnosed in older adults. When breathing repeatedly stops and starts throughout the night, each pause triggers a small stress response, a burst of cortisol and adrenaline, dozens or even hundreds of times in a single night. Over the course of a night, this repeated hormonal disruption can meaningfully elevate blood glucose, completely independent of diet or medication. People with untreated sleep apnea often have overnight glucose elevation they simply cannot explain because the actual driver is happening while they're unconscious. So how does someone figure out which of these is actually happening to them? The answer isn't guesswork. It's structured monitoring done in partnership with a doctor. A commonly used approach involves checking blood glucose at 3 points over the course of about a week. At bedtime, again in the middle of the night around 3 in the morning, and once more upon waking. This middle-of-the-night check is the key piece most people skip, and it's the one that reveals the actual story. If the 3 a.m. reading is similar to or only slightly higher than the bedtime reading, with a real jump happening between 3 and 7 in the morning, that points toward the dawn phenomenon, glucose stable through the night, but rising sharply in the pre-dawn hours. If instead the 3 a.m. reading shows a significant low, well below the bedtime number, with the morning reading then rebounding high, that's the signature of the Samajai effect. And if glucose is already elevated by 3 in the morning and stays elevated through to waking, that often points toward prolonged absorption from a late or heavy dinner, or toward disrupted sleep itself. Once that pattern is identified, the conversation with a doctor becomes much more productive because the appropriate response is genuinely different for each. For the dawn phenomenon, a physician might consider adjusting when certain medications are taken, exploring a longer-acting formulation that provides steadier overnight coverage, or other approaches suited to the individual's full medical picture. For the Samajai effect, the conversation usually centers on reducing rather than increasing evening medication, since the underlying problem is overnight blood sugar dropping too low, not too high. For prolonged dinner absorption, shifting dinner earlier or adjusting its composition, more protein and fiber, fewer rapidly absorbed carbohydrates, might be discussed. And if sleep apnea is suspected, perhaps loud snoring, gasping during sleep, or waking unrefreshed despite a full night's rest, a sleep study is often the right next step, since treating the sleep disorder itself can meaningfully improve glucose control as a downstream benefit. It's worth pausing on just how disorienting this experience can be for someone living with it. Doing everything that's been asked, careful eating, consistent medication, regular checkups, and still waking up to numbers that feel like a verdict on willpower or effort, when in fact the explanation is a hormonal process happening entirely outside conscious control. That gap between effort and outcome is often where people quietly start to feel like they're failing, when what they're actually missing is a piece of physiology nobody walked them through. The reassuring part is that once the actual mechanism is identified, the path forward usually becomes much clearer and often involves a more modest, more precisely targeted adjustment than simply adding more medication across the board. Some people see meaningful improvement from a small shift in when an existing medication is taken. Others find that reducing rather than increasing a dose, once nocturnal lows are confirmed, brings both safer nights and better mornings. Still others discover that an unrelated issue, like undiagnosed sleep apnea, was quietly driving numbers that diet and medication alone could never fully explain. If overnight glucose elevation is something you or someone you care about has been dealing with, the most useful first step isn't a new supplement or a diet overhaul. It's data. A week of bedtime, middle of the night, and morning readings gives you and your doctor something concrete to look at together rather than guessing from a single number each morning. Bring that pattern to your next appointment. Ask specifically about dawn phenomenon versus Samajai effect, and ask whether overnight monitoring or a sleep evaluation might be appropriate for you.